Did you know in this tiny cigarette there are over 4,000 different chemicals? Many people do not understand the harms of smoking cigarettes, but the fact is, smoking cigarettes is not only harmful to our health, but also to the health of those around us. Smoking cigarettes can have very harmful first-hand and second-hand effects. However, there are many health benefits, both short-term and long-term, that come from quitting. Have you ever wondered what's inside a cigarette? Well, I've already told you that in just one cigarette there are over 4,000 different chemicals. Included in these 43 different chemicals, there are 43 known cancer-causing compounds. Just a few of these chemicals that you might have heard of before are nicotine, tar, carbon monoxide, formaldehyde, arsenic, and ammonia. Arsenic is used in rat poison, and ammonia is found in household cleaning products such as Mr. Clean and Windex. As you smoke a cigarette, the amount of these chemicals inhaled into the lungs is increased. In the last puff of a cigarette, there is more than twice the chemicals inhaled than in the first puff. Dr. Lowell Kleinman, a specialist in family medicine, wrote an article discussing the ingredients in cigarettes. In this article, Kleinman stated that at a rate of 10 puffs per cigarette, a 1 to 3 pack a day smoker will inhale anywhere from 70,000 to 200,000 individual doses of mainstream smoke per year. That's a lot of smoke. So what exactly are the negative health effects of these chemicals on first-hand and second-hand smokers? Although first-hand smokers have a higher chance of being negatively affected, those who are exposed to second-hand smoke also deal with health problems. The short-term effects of smoking cigarettes first-hand include more frequent respiratory illness such as coughs, colds, bronchitis, and pneumonia. And for kids and children that are exposed to second-hand smoke, they have more frequent cases of asthma, ear infections, and also respiratory illness. These are some of the less serious short-term health complications that come with smoking cigarettes. Now on to the long-term effects. Long-term effects of smoking cigarettes can range from not so serious to very fatal. Some of the non-fatal long-term health effects that come from smoking cigarettes include damage to the lining of the blood vessels, which causes bad blood circulation, erectile dysfunction in males, infertility, rheumatoid arthritis, dementia, cataracts, gum disease, and tooth loss. However, a lot of the serious long-term issues that come from smoking can often be fatal. Dr. Karen Larson, a family physician specializing in internal medicine, wrote an article about the health effects of smoking. In this article, Larson states that there are numerous diseases linked to long-term smoking, including cancer of the mouth, throat, and lungs, and also increases your risk of bladder, kidney, cervical, and pancreatic cancer. Dr. Larson also explains that about 1/3 of all cancers are linked to tobacco use, and 90% of lung cancers are linked to smoking. According to the World Health Organization, there will be about 1.7 billion smokers by 2020. They also estimate that about 1 billion people will die from smoking in the 20th century. Another doctor named Harrison Wine, who specializes in molecular biology and health communications at the National Institute of Health, wrote an article titled "Stamp Out Smoking." In this article, Dr. Wine explains that cardiovascular disease caused by smoking cigarettes is responsible for 800,000 deaths per year nationwide. Also, many people are still falling victim to secondhand smoke. In the same article by Dr. Wine, he states that researchers estimate that about 2.5 million non-smokers have died from secondhand smoke since 1964. However, even for people who smoke a lot, there are many short-term and long-term benefits to quitting. The positive health benefits from quitting smoking begin almost immediately. Colin Tidy, a doctor with over 22 years of experience as a general practitioner, published an article titled "Smoking: The Facts." In this article, Tidy explains and breaks down the immediate and long-term benefits of quitting smoking. He says that if you stop smoking by the age of 35, your life expectancy is only slightly less than that of somebody who has never smoked. And if you stop smoking by the age of 50, you decrease the chance of dying due to smoking-related disease by 50%. Also, in the same article, Dr. Tidy displays a chart explaining the breakdown of the health benefits starting at just 72 hours after quitting, all the way to 15 years after quitting. After just 72 hours, breathing becomes easier and energy levels increase. And after 1 month, skin appearance can improve. And after 3 to 9 months, breathing problems improve and lung function can be increased by up to 10%. If you manage to go an entire year without smoking, your risk of heart attack falls to about half that of a smoker. And if you manage to go 10 to 15 years without smoking, your risk of cancer is greatly reduced and your risk of heart attack falls to about the same level as someone who has never smoked before. So as you can see, smoking cigarettes can have very harmful effects on your health, both short-term and long-term, for both first-hand and second-hand smokers. However, the positive health benefits to quitting smoking can greatly decrease your chances of getting very serious diseases caused by smoking and greatly increase your overall health. Thank you.